Next, I'd like to introduce Dr. Adinoff. He recently retired from the University of Texas Southwestern Medical Center and is a psychiatrist for the last 30 years with the Veterans Affairs Department. He is also the editor-in-chief of the American Journal of Drug and Alcohol Abuse. Dr. Adinoff, welcome. Thank you so much.
Thank you. Good to be here.
Good to be here. Can you tell us a little bit about your medical background and your experience with available PTSD treatments for veterans?
Sure. I'm an addiction psychiatrist. I'm also the Executive Vice President, Doctors for Cannabis Regulation, and I'm presently a clinical professor at the University of Colorado Medical School. As you said, I was in Dallas for a long time, for 23 years, where I was a distinguished professor of alcohol and drug abuse research and a VA doc for the last 30 years. Well, not the last 30 years. So I left Dallas a couple of years ago in full-time academia, partly to move to Denver to be with family, partly to be able to focus on drug policy reform more than I was. As Dr. Marks was saying, there's an intimidation factor, and although the university and the VA didn't tell me, they never said I can't be involved. I certainly couldn't identify myself as I do now, as being a professor at UT Southwestern or at the VA. And now I love it that I can, and they can't do anything about it. It's my way of sticking it to the man after being the man for so many years. Let me start by, I was asked to first talk about PTSD in terms of just what it is and what the traditional treatments are. PTSD is post-traumatic stress disorder, and it can happen to people that have been exposed to severe trauma, meaning any threat to health, body, potential for death, serious injury, sexual violence, domestic abuse, anything that again threatens bodily harm or severe intimidation. And there's 4 symptom complexes that are diagnostic for PTSD. And Jason kind of went through those for us. One is intrusive symptoms like flashbacks and nightmares that Jason talked about. Avoidance, stimuli becomes, any stimuli can be so overwhelming that the person will begin to avoid anything, people, places that may provoke these intrusive thoughts. Hypervigilance, where as I'm saying, you become numb because the surrounding environment always has you on edge, looking around, waiting for the car to backfire, or someone to say something that's going to set you off. And numbness, a way to kind of pull back from everything. And these, as Jason talked about, these can be really debilitating and frightening to the person and people around them. So medications that we've been hearing about that have been commonly used are SSRIs, which are antidepressants like Paxil. The weight gain like that is certainly unusual, but it can cause weight gain. And all the, we've all taken medications for various things. There can always be side effects, and it varies for different people. Another medication commonly used is Prazosin, that's good for nightmares. There's no other medications that, in fact, sertraline is the only one that's actually FDA approved for PTSD. But there are a lot of medications that can be used for the anxiety, the depression, the hypervigilance, the nightmares. And as we've heard many times, the patient lands up getting a bunch of these together. And then, of course, you get your medications to treat the side effects of the medications. Now, some people respond well. Other people do not. There's other things that can be helpful for PTSD, behavior treatments like exposure therapy, where you actually expose yourself to the trauma by talking about it. and then working through that over time. Cognitive behavioral therapy that's used for a lot of different things. In this case, correcting cognitive patterns that are getting in your way. EMDR, which is a guided eye movement. I see Jason nodding his head. I suspect with all his treatments, he's been exposed to all of these. And then there's often coexisting depression and anxiety. Obviously, this doesn't work for everybody, I'm sorry. Some people it works for. And often there's side effects, and cannabis is an option that should be offered. In terms of the research, I get asked about this a lot. There's really not good research to support it. Not that it argues against it, but these are very difficult studies to do. There's one study with navalone that is a synthetic cannabinoid. And it was in a small study, and the findings were significant. But again, it was like 10 people got placebo, and then they got cannabis. As I said, they're difficult to do. And in the political environment, these studies, even though it's been 24 years since cannabis was approved legally in California for medicinal purposes, it remains enormously difficult to do these studies. There are, in addition to these small number of studies, there's a number of observational studies, but these aren't the best studies. I guess, V, you're doing some of these because you're working with a group that's taking the drug and taking cannabis, and then they report, but that's not the optimal sample to do these kind of studies on. And if you look at the literature, some say it's useful, some say it's not. And it's such a complex medication. There's so many different cannabinoids, flavonoids, terpenes, flavonoids, I'm sorry, and terpenes, and it just gets very complex. And from my perspective, does it really matter? Jason, if I told you the research is straightforward, cannabis doesn't help with PTSD, will you say, oh, well then never mind, give me my other medications that zonked me out and didn't help?
No, doesn't happen. No way.
Right.
No way.
And so I really, when I got involved with this, I got involved because I believed that the drug war was a terrible thing and wasn't helpful and was damaging to society. But after I've heard, Jason and B and April, these stories over and over again, as Dr. Wendy Ascoose said last year at this meeting, it's safe enough, given the downsides of not treating PTSD. As mentioned, it's not going to kill anybody. I did have an interesting interaction at the VA. And by the way, listening to these stories that I hear about the VA, I always think, oh my God, did I do that? And I certainly couldn't talk about cannabis as a potential medication. But I remember one of the therapists, when I brought up my feelings about this, she said, I can't tell you the number of veterans that have tried cannabis and have problems because of it and come to me because of it. Because cannabis can cause problems. It can cause anxiety. It can worsen anxiety. It can worsen depression. And I said, yeah, I hear you, but you're not seeing the folks that, number one, get better because they stop coming. And you're not hearing from the folks that are using cannabis, but are afraid to say anything. So I'll stop there.
Definitely, I understand. To kind of follow up with that, have you observed any personal bias against medical cannabis from your colleagues? And have you seen it affect the way that they speak to cannabis about cannabis treatment to their patients?
Yes, I have heard the bias. I just gave you an example. I don't know anyone I worked with. And actually at that time, I I don't know. I was not recommending cannabis at that time. Again, in that environment, it's kind of difficult. So I don't think that there was enough known, nor is there enough known for many doctors, particularly in Texas, in a VA system or the university system, to feel comfortable talking about it. I think any VA doc who recommended it, they may be, I think some may have been recommending it on the down low and not confidentially to patients, but it's nothing they would or could be overt about. So, and again, we like studies. We like studies that show, okay, people given cannabis compared to placebo do better with cannabis if they have, say, PTSD. We don't have those studies to point to. So unless you're actively listening to patients like Jason, I'd be interested to hear to Jason, has he been back? Has he been to the VA? Has he talked to them? Because that's what they need to hear.
I haven't been back since that doctor took away my medication, and you could understand, I'm really sore about that subject.
Understood.
It was like me, sticking it to them, like I have it in me. I don't want to use the VA. I have TRICARE because I'm retired, so I just use my TRICARE instead of the VA.
Do you tell your docs at TRICARE?
I recently had to go and I told them yes that I was using cannabis because they gave me a list of prescriptions that I was last prescribed whenever I was there, and I was laughing at it because it was a long list, and the nurse was like, well, is that a list wrong? I was like, yes, I don't take any of these medications anymore. And then she started asking, well, what are you using? And I told her exactly what I was using.
And did it go, was there any response?
No, not really. She didn't, there wasn't a negative or a positive response. So we just went along with the rest of the appointment. But it was for pain though. And I didn't ask for any pain medication or anything like that. I was asking for some physical therapy or some injections, some steroid injections for my plantar fasciitis.
Even this came up earlier in terms of physician fear. I would not, if I was using cannabis in Colorado, where it's legal, I still would not want it on my medical chart, because on my malpractice insurance, it says, it makes real clear if you use any illicit federal substance, it can void your insurance. So I don't want it on there.
Wow. That's amazing.
And just a side note, if I can interject on that, insurance I found for life insurance is working the same way when they request your medical records, because I was forthcoming and shared my experience in Washington. I was denied life insurance because of cannabis use. Doesn't matter if it was currently or prior, they saw it's in the medical records, and that was the reasoning that I got for the denial. So it seems to be if it's in your medical records, it could ultimately come back. And I think that's a lot of the apprehension, is not even just currently, but in the future, what are people going to do with this information?
Yeah, definitely.
Go ahead.
Okay. Oh, thank you. I actually used TRICARE Prime as well, and I ended up in the emergency room a few years ago, and they did a drug test. I wasn't necessarily aware of it because I was in a lot of pain, and the doctor came back and diagnosed me with cannabis use disorder after a positive drug test with THC in my system, and that went on my record. Being who I was, I did my research and noticed that there has to be, I believe, 10 to 12 steps in order to even give that diagnosis. And it did come up in my insurance. They were like, hey, you have cannabis use disorder. And I showed them where I had gone to the hospital and actually fought it. And they gave me paperwork where I could remove cannabis use disorder from my medical record. but I kind of left it there to sort of show that procedures are not necessarily being followed. And there's people like myself that have cannabis use disorder on their medical record without actually having the disorder.
I used to see that all the time with trainees where they would give a diagnosis. Somebody would come in with alcohol use disorder and cannabis abuse and or opioid use disorder and cannabis abuse. And I would ask where that came from. Well, they smoke cannabis. Okay, yeah, but do they have lost control? Do they have consequences, et cetera? And I said, if they told you they had a drink every few days, would you give them alcohol use disorder? On the other hand, they smoke a pack a day of cigarettes, and you didn't bother mentioning that they have nicotine use disorder, which is far, far more likely to kill them than anything else they're doing.
Definitely. And that's when we have to look at the biomedical model of care and figure out what is it within that we can help our physicians be more aware of what's going on and what these kind of categories of diagnosis can do to the patient, especially as trainees. Now, Dr. Marks, I wanted to ask you one more thing. Can you tell us a little bit about the safety of cannabis versus opioids?
That's certainly. I mean, the unique the unique simple answer is really just looking at the fact that, you know, the number one cause of accidental death in our country being overdose of opioids. You know, it causes respiratory depression, and unfortunately, it's if somebody reaches that point where their breathing is in fact going to slow down, they oftentimes don't know that that's about to happen. Yeah, their body starts getting weak. They might get tired. They fall asleep, and they simply just never wake up. Fortunately, that's never happened with any of my patients, but I also don't really prescribe very much opioids in my practice. Relative to that, you've got a drug that doesn't cause respiratory depression, which is cannabis. So it makes it a very clear cut distinction between the two. It kind of makes me think back to something that Dr. Adinoff was mentioning when he's talking about studies and how people look for evidence-based medicine. And I think, you know, people would love to say, well, here's an evidence-based medicine about, you know, what's going to be the safer of the two or whatever. But when the data is so clear that one is not particularly dangerous in that context, and the data is so clear that the other one so definitively is, frankly, I find it almost intriguing that we even have to have the conversation about this to try to make that distinction. Really, I think that one of the big distinctions that needs to be had and needs to be made is when people look at medical cannabis and try to compare it to alcohol and cigarettes, when really they should be comparing it to Valium, you know, other benzodiazepines or other opioids. You know, compare it to medications. You know, one of the risk factors that people think about when people are using medical cannabis is, well, you know, there's in fact the one person who testified against it a couple of years ago at the session, I think in 2017, the president of the Texas Pain Society, the only person to testify against it, with whom I spoke prior to the testimony, and I asked him why he felt that way, and he said because he tried it once in college, and that is not a medicine, and that was literally his knowledge about it. And I canceled my membership in their organization subsequently because I saw how somebody would use their position to argue against it. But what I find really interesting though is every study that you ever read about cannabis tends to end with more research is necessary. Nobody wants to just come out and say, all right, look, let's just call a spade here. This ain't dangerous. It may help with practically everything that they've tried. Sure, there are some things it might not help with. I'm not going to say it's everything, but so many things it has potential to help with. Do I really need a study that says that it's going to be 72% efficacy. And what if it's only 48% efficacy for an indication? Well, if there's not a particular risk involved in using it, then who cares? Let people try it because it's safer than the alternative options that are out there. Yet you shouldn't drive a car while you smoke pot or ingest pot, I guess I should say, when you're using medical cannabis as a tincture, whatever route, whatever modality by which somebody uses it. You shouldn't drive, sure, but you also shouldn't drive if you're taking Benadryl or if you're taking Ambien or if you're taking an opioid or Valium. It needs to be considered more as a medicine and not so much as a recreational drug. So in terms of the direct, simple answer to your question about, yeah, how does it compare to opioids? Unquestionable. Frankly, even compared to alcohol, I think since everybody who really analyzes what goes on in the political spectrum, and I've been saying this since 2012, that the inevitability is going to be recreational federally. I think everybody knows that. Really, Texas is just putting themselves further and further behind the 8 ball and missing out on opportunity in that interim process. But considering that the inevitability of it is going to be that, I can tell you when it comes to even just like my own kids, 5-10 years from now, they get old enough to be able to start drinking alcohol versus using cannabis, knowing that both of them will probably be recreational. I know that cannabis is going to be the safer option between the two of them. I'd probably be telling them to use cannabis over alcohol, but it sure as heck is safer than opioids.
Definitely. I think all of us here on this panel can definitely agree with you on that one. Is there anything else anybody else would like to add?
I just want to ask Dr. Adinoff, I'm just curious of your thoughts, because I know that you were mentioning how doctors, obviously, we all appreciate and respect evidence-based medicine, but I'm curious about your feelings about the role of evidence-based medicine when it comes to cannabis, because I know I've had a lot of conversations with a lot of people about this, but I'm very curious to get your take coming from an academic institution.
I'll refer back to the talk I heard from Wendy Askew, because it really left an impression on me, because I struggle with this. I mean, that's what I did for my career, was evidence-based medicine. We lived and died by it. And we died by it a lot. I use the example of my dad, who 81 years old, really doing great, went to a computer class, came home and died. I'm convinced it was from a COX-2 inhibitor. And these are pain medications that, they're a type of non-steroidal, that after many people died from them, from cardiac disease, it was found out that the pharmaceutical had covered it up, that these were actually very dangerous drugs and caused thousands of deaths. This is not an unusual story. Think of the opioid crisis. It was started by doctors carelessly giving opioids to hundreds of thousands of patients. So the evidence-based approach, waiting for FDA approval, is definitely not fail-safe. And I think we all have stories. We've heard from some of you about the harms that come from this approach. So given, I thought you said it great, Dr. Marks, in terms of, given a perhaps not fully tested evidence-based medicine like cannabis versus what we know are very dangerous medications that are FDA approved and evidence-based, I'll go with cannabis. And people see that. I mean, the vast majority of people, even Republicans, it doesn't matter on the party, support cannabis legalization, particularly for medical purposes. It's the doctors that are lagging behind.
Do you feel the same way I feel, though, that one of the big reasons the doctors are lagging behind is because doctors are scared to speak up?
I think doctors are just kind of scared. That's not, they are, but yes, they're definitely scared to speak up. And when people complimented me on doing it, I said, yeah, I'm 2 years from retirement, I'll have a pension, I can leave when I want. So I'm in financially in a place where I can't afford to do this. I wasn't doing it, you know, when my kids were at home and I had a family to raise. So I don't want to judge them, but I think they're scared professionally. But we're also a cautious, we were trained in a certain way to use certain types of evidence before we gave medication. And this is breaking from that mold.
Interesting. I will say, because I'm scared at times, you know, I go out and I talk about this and, you know, I fear retaliation and I fear that somebody's going to try to make an example out of me because I talk about it with patients. But, you know, I do what I do because I feel like I know enough and have researched enough, and I just have a really hard time ethically not coming out and speaking the truth about it. But, you know, as a physician, it is something that it scares me at times. You know, I sometimes wonder, am I going to get a letter from somebody that's going to say, hey, we want to talk to you about, you know, what you're coming out and saying. But it's the way of the future, and it's what we need. And I feel like there's so much that needs to be discussed, and doctors need to be less fearful about it.
Yeah, and kudos to you for doing this.